Hello, this is Dr. Tricia Shimer of Tricia Shimer MD-PA in Dallas, Texas. And today I'd like to share with you a live FRACTORA treatment. FRACTORA is used to treat fine lines, skin irregularities, texture issues, acne scars, and a whole host of other issues that arise as we age. So today Jennifer has been kind enough to volunteer for her fourth FRACTORA treatment, and she is allowing us to show this live. She has had numbing cream on for about an hour, and this is standard. We do this for everybody so that the area treated has plenty of time to be anesthetized for the procedure. In addition, you see her holding some tubing that is connected to nitrous oxide. It's called Pronox. It is in-office nitrous oxide to provide pain relief during the procedure. The combination of the numbing cream and the Pronox make it a very tolerable procedure. So I'm going to get started by removing the numbing cream. And it's very important on the day of the procedure to come in with a clean face, so not applying any makeup or moisturizers or anything to the skin. Sometimes the numbing can cause some tingling sensation, slight burning sensation, but it works very, very well. It's medical grade prescription numbing cream, so it works incredibly well. And the numbing effect actually tends to last a couple hours after the treatment. Between that today as well?
If you want to, yes.
Of course. It's what you want. Mm-hmm. In addition, prior to treatment, it's very important to let us know if you have any remote history of herpes in the area being treated, as we would start an antiviral therapy about 4 days prior to the treatment. In addition, it is important to stop all retinol treatments, topical retinol treatments, 4 to 7 days prior to getting a FRACTORA treatment. We don't want any skin irritants on the skin to be treated. So FRACTORA works by inducing new collagen formation, which collagen is what keeps the skin looking supple and young and firm, which is what we're all going for. I'm sorry. So usually within about 10 to 20 seconds of breathing Pronox, Jennifer will start to feel a little woozy, a little lightheaded, like she's had a margarita or two. Usually we don't see any nausea with this, and the effects wear off within 10 minutes of the treatment. So it's a very nice in-office analgesia is what it's called, pain relief. It's not anesthesia technically, because you can drive after using the Pronox. Tends to really give a nice result. Yep. Feeling it?
Yes.
Okay. Very good. And so the tip we're using, this is the FRACTORA tip. You can see there's some tiny little needles. This is a 24 pin tip. So the needles go just under the surface of the skin to deliver radio frequency treatment. Are you okay if I start on your forehead, or you want me to start elsewhere?
No, that's fine.
And the good thing about the Pronox is it is patient controlled, so she can basically take puffs as needed throughout the treatment, but she doesn't have to keep it in her mouth the whole time. Like at the dentist office, they hook it up to your nose and you have to keep breathing it the whole treatment, but she can basically just use it as needed. We need to let it catch up a second. All right. And you can see that it does create a little bit of bleeding. That's normal. That's the desired effect. And what I'm doing is a double stamp procedure. Sometimes we only make one pass across. Usually in your first treatment, we just do one pass to see how you tolerate it. But since she's had multiple treatments and has done very well with them, we can do a little bit more aggressive treatment. It's also better tolerated at this point because she's got the Pronox. When we had our first treatments, we did not yet have the Pronox in the office, and it's really made a difference. You are doing great. Tends to be the forehead is the most sensitive area, and she is tolerating it very, very well. Again, the Pronox really helps, and the numbing cream. Jennifer also performs these procedures. She does my FRACTORAs and does a very nice job on them. Gonna get our favorite part, as we kindly refer to them as our 11s, but Jennifer's are disappearing. All right, let's turn your head. Doing great. So we can get the area around the eyes as well.
Jennifer, do you want to say hi to Melissa?
I don't know, I'm too numb to say hi.
Hi, Melissa.
She says hi.
Get your chin. Need some more puffing? Good.
Maybe some more.
Yeah.
So what happens if I have an allergic reaction to the lidocaine cream? What can I do?
So we can prescribe a Benadryl dose pack after or some Benadryl cream afterwards. The agent that typically causes the allergic reaction is not included in this cream combination. So most people do fine with it. Sometimes if somebody has a severe allergy to lidocaine or tetracaine, well, this is actually tetracaine cream, we can just do it under Pronox. That has actually been successful before, and just do it at lower settings. That way, start back up here. Especially when we go around the eyes, there can be some twitching from the nerves. Very, very, very normal. Doing great. And it is very normal to you can have a little bruising after this. You will see some scabs form about 3 days after the treatment, but usually by about 10 to 14 days, for sure, all of those scabs are gone. The day of, you leave looking very red most of the time. So it's best not to do this on an evening where you've got big plans, because the skin will feel very warm, it will be very red, which is what we want. We're inducing a bit of an inflammatory reaction so that your cells can get healthier in the skin, start producing more collagen, more elastin to help fill in lines and make you look younger. That is the goal. So I'm going to have, why don't we, this is how we look after, and we'll end the Facebook Live. I'll do the neck because this gives a good view of the treatment. So if any of you have any questions, please feel free to give us a call, email, comment on Facebook. We'd love to see you. The FRACTORA is a wonderful treatment. We will get some before and afters posted as well because we are seeing great results with it. So again, thanks for tuning in, and we'll see you soon.